Stop right there. If you're over 60 and your doctor told you your blood pressure is fine at 140/90, you might want to watch this entire video before you take another step, because what I'm about to share could add years to your life or prevent a stroke that changes everything. Here's something that might shock you. For decades, millions of seniors have been living with dangerously high blood pressure, told it was normal for their age. But recent medical research has turned everything we thought we knew completely upside down. The numbers your doctor called acceptable 20 years ago, they might be putting you at serious risk right now. I'm going to reveal the truth that medical professionals are finally admitting, and trust me, this isn't what you've been told before. Hello, and welcome back to the channel. If you're new here, I'm dedicated to bringing you honest, clear, and potentially life-saving health information specifically for those of us in our golden years. And today's topic, it might be the most important video I've ever created for anyone over 60. We're talking about blood pressure, those two numbers that your doctor rattles off at every appointment. For years, maybe decades, you've been hearing what's normal and what's high. But here's the truth. The medical community has been changing the guidelines, and many seniors, perhaps even you, are still operating on outdated information. This isn't just about numbers on a chart. This is about preventing heart attacks, strokes, kidney disease, and dementia. This is about protecting your independence, your quality of life, and the precious years you have left to enjoy with your grandchildren, your hobbies, and everything that brings you joy. So settle in, because by the end of this video, you'll know exactly where your blood pressure should be, why the old normal was dangerously wrong, and what you can do starting today to protect yourself. Let me start with something you've probably heard from a doctor, a nurse, or even well-meaning friends. Your blood pressure is a little high, but that's normal for someone your age. Sound familiar? Maybe your reading was 145/92 or 150/88, and your doctor didn't seem too concerned. Let's just keep an eye on it, they said. Here's what they weren't telling you, and in many cases what they didn't fully understand themselves until recently. There is no safe higher number just because you're older. For years, the medical establishment operated under a dangerous assumption. They believed that as our blood vessels naturally stiffen with age, higher blood pressure was inevitable, even acceptable. Some doctors used a simple formula: 100 plus your age equals acceptable systolic pressure. By that outdated logic, an 80-year-old could have a reading of 180 and be considered normal. Can you imagine? We now know this thinking has contributed to hundreds of thousands of preventable strokes and heart attacks in seniors. The truth that research has confirmed again and again is this: high blood pressure damages your blood vessels, your heart, your brain, and your kidneys, no matter how old you are. Age doesn't give you a free pass. In fact, the older you are, the more dangerous high blood pressure becomes, not less. Think about it this way. If you had a water hose and you constantly ran water through it at very high pressure, what would happen? Eventually, weak spots would develop, the hose would become brittle, and it might burst. Your blood vessels work the same way. Higher pressure over time means more damage, more risk, more danger. Before we go further, let's make sure everyone understands what we're actually measuring. Blood pressure gives us two numbers, and both matter enormously. The first number, the higher one, is called systolic pressure. This measures the pressure in your blood vessels when your heart beats and pushes blood out. Think of it as the working pressure when your heart is actively pumping. The second number, the lower one, is diastolic pressure. This measures the pressure in your blood vessels when your heart rests between beats. Both numbers tell us important things about your cardiovascular health. Now, here's where the guidelines have changed dramatically and where many doctors are still getting it wrong. For years, a blood pressure reading of 140/90 was considered the threshold for high blood pressure. Below that, you were told you were fine. At that level, let's watch it. Above that, time for medication. But in 2017, the American Heart Association and the American College of Cardiology dropped a bombshell. They released new guidelines based on massive research studies involving hundreds of thousands of patients. The new threshold for high blood pressure, what they call hypertension, is now 130/80. Let that sink in for a moment. If your blood pressure is 135/85, you don't have normal blood pressure. You have stage 1 hypertension, and you need to take action. Even more important, the ideal blood pressure for most people over 60 is less than 120/80. That's what we should be aiming for. Now, I can already hear some of you saying, but my doctor never mentioned this to me. And sadly, you're not alone. Many healthcare providers, especially those who trained decades ago, are still using the old guidelines. Some are resistant to change. Others simply haven't kept up with the latest research. This is why you need to be your own advocate. You need to know these numbers yourself. Let me pause here for just a moment. If you're over 60, or if you're caring for an elderly loved one, this information could genuinely save a life. The statistics are clear. Controlling blood pressure in seniors prevents more heart attacks and strokes than almost any other medical intervention. I want you to do something for me right now. Think about the last blood pressure reading you received. Do you remember the numbers? Were you told they were fine? After watching this video, you might see those numbers in a completely different light. If you're finding this information valuable, please hit that subscribe button and the notification bell. I create content like this every week specifically for our senior community, and I don't want you to miss anything that could protect your health. Now let's talk about something doctors call pre-hypertension or elevated blood pressure, that zone where your numbers aren't quite at the old high threshold, but they're not ideal either. If your blood pressure consistently reads between 120/129 systolic and less than 80 diastolic, you have elevated blood pressure. This isn't stage 1 hypertension yet, but it's a red flag. It's your body's warning system telling you that changes need to happen now before things get worse. And here's what makes this so dangerous for seniors. Most people in this range feel absolutely fine. No symptoms, no warning signs. Life goes on as normal, so they ignore it. But research published in the Journal of the American Medical Association followed thousands of seniors with these borderline readings. The results were sobering. Those with readings consistently in the 130s and 80s had a 90% higher risk of serious cardiovascular events compared to those who kept their pressure below 120/80. 90% higher risk. That's nearly double. This is why the let's just watch it approach can be so dangerous. Every month you watch elevated blood pressure is another month of damage to your blood vessels, your heart muscle, your kidneys, and your brain. Let me share something particularly important for those of you concerned about dementia and Alzheimer's disease. Groundbreaking research from the Sprint Mind study showed that seniors who aggressively controlled their blood pressure, getting it down below 120 systolic, had a significantly lower risk of developing mild cognitive impairment, which often leads to dementia. Your brain needs healthy blood flow to function properly and to clear out the proteins that cause Alzheimer's disease. When blood pressure is high, tiny blood vessels in your brain get damaged. Over years and decades, this damage accumulates, affecting memory, thinking, and eventually your ability to live independently. I've seen this in my own family. My uncle lived for years with blood pressure in the 140s/90s. His doctor told him it was fine for a man his age. At 73, he had a massive stroke that left him unable to speak or walk. The blood pressure that was fine had silently damaged blood vessels in his brain until one finally burst. I don't want this to be your story or the story of someone you love. Now you might be wondering, if this information is so important, why isn't my doctor telling me? That's a fair question, and the answer is complicated. First, as I mentioned, some doctors simply haven't updated their knowledge. Medical school was a long time ago for many practicing physicians, and unless they actively pursue continuing education in cardiology, they might still be using guidelines from the 1990s or early 2000s. Second, there's been genuine debate in the medical community about these new guidelines, especially for seniors. Some doctors worry about the side effects of blood pressure medications in elderly patients. Others are concerned about the risk of falls if blood pressure drops too low. These are legitimate concerns, and they've made some physicians hesitant to push for lower numbers in their older patients. But here's what the research shows. When blood pressure management is done carefully, with appropriate medications and monitoring, the benefits far outweigh the risks, even in patients over 75, even in patients over 80. The landmark SPRINT trial, which studied more than 9,000 adults over age 50, found that targeting a systolic blood pressure of less than 120 rather than less than 140 reduced the risk of heart attack, stroke, and death by 25%. 25%. And the benefits were actually greatest in the oldest participants. Third, and this is uncomfortable to say, some healthcare systems and insurance companies have been slow to adopt the new guidelines because aggressive blood pressure treatment requires more medication, more monitoring, and more follow-up visits. It costs more, at least in the short term. But the long-term costs of strokes, heart attacks, kidney failure, and dementia are astronomically higher, not to mention the immeasurable cost in human suffering. So, what does this mean for you? It means you need to be proactive. You need to know these numbers yourself. You need to ask your doctor specifically, based on the 2017 guidelines from the American Heart Association, where does my blood pressure stand? Should we be doing more to get it lower? Don't accept vague reassurances. Get specific answers. Here's one of the scariest things about high blood pressure. It's called the silent killer for a reason. Most people have no symptoms at all until something catastrophic happens. But there are some warning signs that your blood pressure might be dangerously high, and if you experience any of these, you need to check your blood pressure immediately and possibly get emergency help. Severe headaches, especially ones that come on suddenly or are different from your normal headaches, can indicate a hypertensive crisis. This is when blood pressure spikes to dangerous levels, usually 180 over 120 or higher. Vision changes, such as blurred vision, seeing spots, or temporary vision loss, can mean that high blood pressure is affecting the blood vessels in your eyes or your brain. Chest pain or tightness is always a medical emergency. It could mean your heart isn't getting enough blood flow, possibly because of blood pressure issues. Difficulty breathing or shortness of breath with minimal exertion can indicate that your heart is struggling to pump effectively against high pressure in your blood vessels. Severe anxiety or a feeling of impending doom, especially if it comes on suddenly, can accompany dangerous spikes in blood pressure. Nosebleeds that are frequent or difficult to stop can sometimes be related to very high blood pressure, though this is less common. Now, most people with high blood pressure won't experience any of these symptoms. Your blood pressure could be 150 over 95 right now, and you'd feel completely normal. That's why regular monitoring is so absolutely critical. If you're over 60, you should be checking your blood pressure at least once a week at home and at every doctor's appointment. If you have hypertension or are on blood pressure medication, you should be checking even more frequently, possibly daily, depending on your doctor's recommendation. So what should your blood pressure be? For most people over 60, the target is the same as for younger adults. Less than 120 over 80 is ideal, and definitely less than 130 over 80. But, and this is important, every person is different. There are some specific situations where slightly different targets might be appropriate. If you have multiple serious health conditions, if you're very frail, if you have a history of falls, or if you have certain types of kidney disease, your doctor might set a slightly more lenient target for you. The key word here is might. It's a medical decision that should be made carefully based on your individual circumstances, not a blanket assumption that old people can have higher blood pressure. The American College of Physicians and the American Academy of Family Physicians suggest that for seniors over 60, initiating treatment at 150 over 90 might be acceptable if you have no other cardiovascular risk factors. But this is a minimum standard, not an ideal target. And if you already have heart disease, diabetes, kidney disease, or a history of stroke, you absolutely need tighter control. Back to that less than 130 over 80 target. Here's my advice. Don't let anyone tell you that higher blood pressure is normal for your age without a specific evidence-based medical reason. Ask questions. Push back if necessary. Questions you should ask your doctor. What is my target blood pressure and why? Am I at my target now? If not, what can we do to get there? Should I be on medication? Or can lifestyle changes get me where I need to be? How often should I be monitoring at home? These aren't confrontational questions. They're collaborative questions that show you're engaged in your own health care. Any good doctor will appreciate your involvement. Now for the empowering part. There is so much you can do to lower your blood pressure, protect your cardiovascular system, and reduce your risk of stroke and heart attack, starting right now, today. Let's talk about the most effective strategies in order of impact. Number 1. Reduce your sodium intake. This is the single most powerful dietary change most seniors can make. The average American consumes more than 3,400 milligrams of sodium per day. For optimal blood pressure control, you should be aiming for less than 1,500 milligrams, 2,000 at the absolute maximum. Where does all that sodium come from? It's not the salt shaker on your table. That's only a small fraction. The real culprits are processed foods, restaurant meals, canned soups, deli meats, frozen dinners, bread, cheese, and condiments. Start reading labels. Anything with more than 200 milligrams of sodium per serving should be reconsidered. Choose fresh foods whenever possible. Cook at home more often. Use herbs and spices instead of salt for flavor. Within just a few weeks of reducing sodium, many people see their blood pressure drop by 5 to 10 points. That's significant. Number 2, adopt the DASH diet. DASH stands for Dietary Approaches to Stop Hypertension, and it's been proven in study after study to lower blood pressure naturally. The focus is on fruits, vegetables, whole grains, lean proteins, and low-fat dairy, while limiting saturated fat, red meat, and sweets. The beauty of the DASH diet is that it's not extreme or restrictive. It's simply a balanced, healthy way of eating that also happens to be one of the most effective blood pressure treatments available, medication or not. Number 3, maintain a healthy weight. Every pound you lose can reduce your blood pressure by about 1 point. If you're carrying extra weight, even a modest loss of 5 to 10 pounds can make a measurable difference. I know weight loss gets harder as we age. Our metabolism slows down, we may be less active due to arthritis or other conditions, and honestly, food is one of life's pleasures we don't want to give up. But this isn't about vanity. This is about staying independent, avoiding disability, and being there for the people you love. Number 4, get moving. Physical activity is like medicine for your blood vessels. Regular exercise makes your heart stronger, so it doesn't have to work as hard to pump blood. It helps your blood vessels stay flexible. It reduces stress hormones that can raise blood pressure. You don't need to run marathons. For most seniors, 30 minutes of moderate activity most days of the week is the goal. That could be brisk walking, swimming, water aerobics, dancing, gardening, anything that gets your heart rate up a bit and makes you breathe a little harder. If 30 minutes is too much right now, start with 10 minutes. Something is always better than nothing, and always check with your doctor before starting a new exercise program, especially if you have existing heart conditions. Number 5, limit alcohol. If you drink, moderation is key. For most people, that means no more than 1 drink per day. Excessive alcohol consumption raises blood pressure and can interfere with blood pressure medications. Number 6, manage stress. Chronic stress keeps your body in a state of high alert, which elevates blood pressure. Find healthy ways to relax: meditation, deep breathing exercises, yoga, prayer, time in nature, hobbies you enjoy, time with loved ones. Even just 10 minutes a day of quiet, deep breathing can lower your blood pressure measurably. Number 7, get enough sleep. Poor sleep or sleep apnea can contribute to high blood pressure. Most adults need 7 to 8 hours of quality sleep per night. If you snore loudly or wake up feeling tired despite sleeping enough hours, talk to your doctor about sleep apnea testing. Number 8, monitor at home. Buy a good quality home blood pressure monitor. Your pharmacist can help you choose one. Check your blood pressure regularly at the same time of day and keep a log. Bring this log to your doctor appointments. Home monitoring gives a much more accurate picture of your blood pressure than a single reading at the doctor's office where you might be nervous. That's called white coat hypertension, And number 9, take medications as prescribed. If lifestyle changes aren't enough, and for many people they aren't, blood pressure medication is not a failure. It's a tool, it's protection. Modern blood pressure medications are generally safe, effective, and have far fewer side effects than the medications from decades past. Never stop taking blood pressure medication without talking to your doctor first, even if you're feeling fine. Remember, high blood pressure rarely has symptoms. Feeling good doesn't mean your pressure is controlled. Before we wrap up, let's bust a few common myths that might be putting your health at risk. Myth number 1. I feel fine, so my blood pressure must be fine. Wrong. High blood pressure usually has no symptoms. You can feel perfectly healthy while your blood pressure is silently damaging your organs. Myth number 2. Blood pressure medication will hurt my kidneys. Actually, uncontrolled high blood pressure is one of the leading causes of kidney failure. Blood pressure medications protect your kidneys by reducing the pressure damage to the tiny blood vessels that filter your blood. Myth number 3. Once I start blood pressure medication, I'll be on it forever. Not necessarily. If you make significant lifestyle changes, lose weight, change your diet, exercise regularly, you may be able to reduce your medication or even eliminate it under your doctor's supervision. But even if you do need medication long-term, that's far better than the alternative. Myth number 4. My father lived to 90 with high blood pressure, so I'll be fine too. Genetics play a role, but so does luck. Your father might have been fortunate, or he might have had a stroke at 70 that you don't know about. Either way, why take the risk when you can protect yourself? Myth number 5. Lower is always better when it comes to blood pressure. There is such a thing as blood pressure that's too low, especially if it causes dizziness, falls, or fainting. This is why it's important to work with your doctor to find your optimal target and to monitor how you feel as your pressure comes down. Let's bring this all together. For decades, seniors were told that higher blood pressure was normal, acceptable, even expected with age. We now know this was dangerously wrong. High blood pressure damages your body regardless of your age, and in fact, the older you are, the more serious the consequences. The current medical guidelines are clear. For most people over 60, blood pressure should be less than 130 over 80, with an ideal target of less than 120 over 80. If your doctor is still using the old guidelines, if they're telling you that 140 over 90 is fine for someone your age, you now know to ask more questions and possibly seek a second opinion. You have so much power to protect yourself. Through diet, exercise, weight management, stress reduction, and when necessary, medication, you can control your blood pressure and dramatically reduce your risk of heart attack, stroke, kidney disease, and dementia. This isn't about adding years to your life just for the sake of more years. This is about protecting the quality of those years. This is about being able to travel, to play with your grandchildren, to pursue your passions, to live independently in your own home for as long as possible. Your blood pressure numbers aren't just statistics. They're a window into your future health. Pay attention to them, take them seriously, and take action. You deserve to enjoy these golden years with vitality, independence, and peace of mind. Don't let outdated medical advice rob you of that. If this video opened your eyes to something you didn't know about blood pressure, please do 2 things for me. First, share this video with your friends, your family members, your children, anyone over 60 who needs to hear this message. You might literally save someone's life by passing this information along. Second, subscribe to this channel and hit that notification bell. Every week, I create content specifically designed to help seniors and their families navigate the often confusing world of health information. I cut through the myths, I explain the science in plain English, and I give you practical steps you can take to protect your health. Drop a comment below and let me know. Were you told your blood pressure was normal for your age when it actually wasn't? What's one change you're going to make this week to improve your numbers? I read every comment, and I love hearing from you. Thank you so much for watching. Take care of yourself, monitor that blood pressure, and I'll see you in the next video. Stay healthy, my friends.